Good morning, everyone. My name is Matt Shamblin, RN, CEN, TCRN, and I'm here today to talk to you about an issue affecting our healthcare system and the well-being of every individual who relies on the emergency department. Today, I urge you to support the bipartisan bill Senator Shelley Moore Capito introduced, which aims to secure better mental health access in our emergency rooms. This bill, called the Improving Mental Health Access from the Emergency Department Act, is not just a policy change, but a lifeline for countless individuals in crisis and the healthcare professionals dedicated to serving them. Imagine a loved one in the throes of a mental health crisis seeking immediate help. They arrive at an emergency room, a place meant to provide urgent and critical care, only to face long wait times and inadequate resources. This scenario is not a rarity, but a daily reality for many families across our nation. The emergency room, often the first point of contact between those in severe mental distress, is ill-equipped to handle the complex nature of these mental health crises. This bill seeks to change that by ensuring better access and resources for mental health care in the emergency setting. Nationally, our emergency rooms are overwhelmed. According to recent studies published by the Journal of Emergency Nursing, mental health-related visits have skyrocketed, yet the resources to manage these cases remain stagnant. Patients experiencing acute mental health episodes often endure long waits in chaotic and stressful environments, exacerbating their conditions. The lack of specialized mental health resources in emergency departments not only hampers patient care, but also contributes to overcrowding and longer wait times for everyone. This situation is unsustainable and detrimental to both patients and healthcare providers. Did you know on average, mental health patients spend 18 hours in the emergency department compared to 4 hours for everyone else? This is according to the Emergency Nurses Association, or the ENA. Emergency nurses report a significant increase in workplace violence and stress, largely due to the challenges of managing mental health crises without adequate support, as stated in an article published by the JEN. Let's look at some real-world cases that highlight these challenges. Christian Stone, an emergency nurse from Washington, D.C., was attacked by a patient while trying to provide care. This patient, while initially stable, became violent, shoving Christian against a corner and attempted to strangle him. His story highlights the dire need for better protections and mental health resources in the emergency department. Christian's story is just one example of the challenges faced by emergency nurses. Dan Nadworthy, an emergency room nurse for over 20 years, shared his frustration last summer at an ENA meeting about the fractured mental health system. He frequently sees patients in crisis waiting for days, even weeks in the emergency department due to the lack of mental health facilities and providers. This prolonged wait not only exacerbates the patient condition, but also contributes to the overall chaos and violence in the emergency department. These stories clearly demonstrate the urgent need for change. Supporting this bill means advocating for a comprehensive solution to these pressing issues. This bill provides emergency departments with the necessary resources to effectively manage mental health crises, ensuring that patients receive timely and appropriate care. By enhancing mental health services in the emergency settings, we can reduce wait times, alleviate overcrowding, and create a safer, more supportive environment for patients and healthcare providers. The benefits include improved patient outcomes through timely and specialized mental health care, reduced stress and burnout among emergency healthcare providers, and enhanced overall efficiency and effectiveness of emergency departments. Imagine the impact this bill will have on our healthcare system. Picture a healthcare system where emergency rooms are equipped with dedicated mental health professionals and resources. Imagine a scenario where individuals in crisis receive immediate, compassionate care tailored to their specific needs without enduring prolonged wait times or inadequate support. Visualize a safer environment for our healthcare providers where risk of violence and burnout is minimized, allowing them to focus on delivering high-quality patient care. Families will experience relief knowing their loved ones are receiving care that they need quickly and effectively. Healthcare workers will have the support that they need to perform their duties safely and efficiently, reducing turnover and enhancing job satisfaction. Now is the time to make this vision a reality. In conclusion, the Improving Mental Health Access for the Emergency Department Act represents a significant step forward in addressing the mental health crises in our emergency rooms. By providing the necessary resources and support, we can transform our healthcare system to better serve those in need and protect the well-being of our dedicated healthcare providers. I urge each of you to support this bill and advocate for its passage into law. Contact your local representatives. Share this message with your community and highlight the importance of mental health resources in emergency departments. By standing together, we can ensure that our emergency rooms are not just places that are of last resort, but are fully equipped sanctuaries of healing and support for all those who need them. Let's take this opportunity to make a meaningful change. Support the Improving Mental Health Access from the Emergency Department Act, and together, we can create a healthcare system that truly cares for everyone. Thank you.